Okay, one of the most important things in harvesting, particularly when you're doing large harvests of 3,000 grafts or more, is to preserve the donor area. After I know that they're doing good preservation of the donor area, then I know I can harvest more grafts. It's really not a great idea to say we're going to get 7,000, 8,000 grafts out of the back of the scalp without knowing how we're going to heal. We have been using a very specific hybrid punch in a very specific way to minimize the trauma to the donor area. And what we've been seeing in follow-up is just spectacular healing. We use platelet-rich plasma and regenerative medicine to help facilitate that healing, but it almost looks like nothing was taken out. Now we know that there's scars in there in some places because we have to provide some scarring if we're going to take out tissue that way, but we just don't see it. It really is amazing. And we're seeing a lot of regenerative medicine coming into play in the healing process and the sustaining process so we can preserve more donor area. The worst thing that can happen is over-harvesting the donor area. There's no way to fix that. There's no way to repair that. And once that happens to you, you're stuck. So the bottom line is we want to be able to maximize our harvest. We want to use micro FUE punches that are very small in size to minimize any trauma. We want to use regenerative medicine technology to help facilitate healing, and that way we can minimize any damage to the donor area, and we can keep going back to harvest grafts until we can get as many as possible to give you the best result possible.